Hello, Wade here, one of the directors at Corporate Work Health Australia. For some of you, we may already have helped you through home office workstation setups. This video is for organisations who are now faced with the challenge of how do we safely move our team from the office, where hazards and risks are relatively easy to control. Now they're all out in their individual homes. How do we manage the hazards, risks, challenges and controls of that move? As many of you know, it's been forced upon us very quickly. Some of you may have policies and procedures around home office workstation setups where individual workers have previously applied for that, been approved, had a self-assessment form, maybe even had an in-person assessment and said, yes, that person is safe to work from home with their roles, their tasks, and their person. At the moment, you may have 50 workers, 20 workers, 100 workers. We're working with some organisations with 500 workers, 1,000 workers, where that whole workforce is now moved into their home. Some of those workers are going to be set up well. They are. Some of them are going to have a good ergonomic chair, a good desk, 2 screens, set up well with a keyboard and a mouse in a nice home office space, but some of them are just not. Some of those workers that we're seeing are sent home with laptops. Sometimes the whole office is sent home with laptops. We need to manage the hazards and the risks of workers working at home for an extended period of time. We don't know how long, where their home is now their workplace. So as you know, an organisation or a PCBU has a duty of care to provide a safe workplace. Their home is now their workplace. So what we're looking to assist with is helping you manage this challenge well. Several companies we've set up, this is what's working well for several companies. We will send a self-assessment home workstation assessment form home to every worker. It's a Word document. The worker needs to complete that for us, include photos of their chair, their desk, and where they're going to work. So step 1, self-assessment checklist. They will send that back to Heath and I. Heath's the other director down in Victoria, so they'll send that form back to myself being a physio, Heath being an osteopath, and both work health and safety consultants. So they'll send that back to us. We will review that. The next step is we can do a 20 to 30 minute teleconference home office workstation assessment. There's 2 choices here. With every worker, if you feel every worker should be covered, for some companies with large groups of workers, we're going to do the teleconference assessment with the higher risk workers. That would be workers who don't have decent chair setup and workstation at home, or who have complex or ongoing musculoskeletal challenges. So we're going to do a self-assessment form. We will review the form for you. We can set up teleconference assessments as with the entire team. We can set up teleconference assessments as with your higher risk workers. Over and above that, what we're finding is also nice, we can do this before we send people home or after they've had their assessments, is we set up one large group workshop training session. We've got a full presentation ready where we can take the whole team. Everyone can tap into a Skype or Zoom or Google meeting, and we can do a 30-minute home office workstation setup training course for everyone. So we've got a paper record that they've self-assessed, we've got a review of that, we have a teleconference individual appointment where Heath and I will fill out further comments and sign off on that form, and we've also got a training session. So in terms of managing the hazards and risks as an organisation, we feel this is a really nice, effective way for us to help you manage the massive challenge we have at the moment. Corporate Work Health Australia has been completing home office assessments for many years now. We see the ins and outs and the challenges of this, and unfortunately the hazards, risks and challenges have just been amplified at the moment, and it's really been forced upon companies. So if you feel like this can help you, reach out to us. You can reply to this video below. You can jump on our website, www.corporateworkhealth.com.au. We look forward to helping you through this challenging time.